Okay, I can tell you the history of that. It's kind of cool. It actually is kind of hits close to home. My grandpa was a biochemist, and he helped develop the first medicine for dealing with hemophilia. Before that, they would just give patients whole blood transfusions. So they were getting the clotting factor that they needed, but they were also getting like a ton of blood. So it was a lot slower process and, not as efficient. And either that or they would just, lay on their bed until it healed. But, you have like this super swollen knee joint or something that's super painful because the bleeding doesn't stop. And before the medicine that we have today was developed, a lot of hemophilia patients were crippled because of the joint damage and sometimes the brain damage and things like that. So a lot of the older generation have limps and they're not super physically active and all of these things from the issues that hemophilia can cause. And so my grandpa helped to develop this medicine where you isolate the clotting factor from the blood so that it's more concentrated and you can put that in instead of the whole blood. So he was working on that, and he actually at one point experimented on himself, which, is like not something you're necessarily supposed to do in the medical field when you're working on a new medicine. But he did it and it helped him with one of his bleeds. And so they first developed this treatment from human blood. So they would get blood donations and isolate the clotting factor, either 8 or 9. Well, they started with 8 that was needed, and get it down to like a powder form. And then you would mix it with water and put it in a syringe and inject it into your veins. And so then eventually they came up with different methods where you wouldn't need to use human blood, which makes it cheaper and less risky. There was a huge problem in, I think the 70s or 80s with the AIDS infections, I guess, in blood donations, and it affected a huge amount of the hemophilia population because they were getting the factor from those people's blood. And so that's kind of a way that our community is tied in with the AIDS community. Is we've had some people die from AIDS and some other people being affected by AIDS just from blood donations. So now a lot of it is just factory, like made in like labs. So it doesn't have any like human blood or any animal blood or anything in it. And it's just protein made from a lab and makes it a lot safer and a lot easier. So